Hello ma'am, good afternoon. I am Molly and I will be your attending physical therapist for today. How are you?
I'm fine.
Okay, you're fine. Very good. So ma'am, may I ask for your name please?
My name is Otero.
Okay, hello Miss Otero. It's nice to see you here once again. So as I remember it ma'am, we had our examination yesterday in which I asked you several questions regarding your complaints and you have confirmed that you have an underlying condition called multiple sclerosis. And you also asked ma'am, how is it related to your complaints regarding your misalignment of your jaw and also just the sensitivity to touch, which is painful when touched to your face. So I will discuss it to you thoroughly. Okay ma'am, are you ready?
Yes.
Okay, so I want you to listen carefully with what I will be saying, okay? So multiple sclerosis ma'am is the demyelination in which this is the process ma'am in which the protective covering of our nerve fibers is damaged. So when these nerve fibers or when this myelin is damaged, there could lead to different affectations. For example, in your case, there could be misalignment of jaw because of the weakness of the muscles. And also, there could be an altered sensation. That is why you feel pain when touched on the left side of your face. So that is, ma'am, the term demyelination that is mostly occurred in multiple sclerosis. So, as I have assessed, ma'am, this particular issue of yours, since there is this particular cranial nerve, so this is the cranial nerve number 5, or the trigeminal nerve, it has two functions, sensory functions and motor functions. For the sensory functions, it is more on the sensation that you feel. For example, the touching, the sharp, mostly on the skin. And when we say the motor function, this is the movements of your jaw, like opening, closing, putting your jaw to the side, to the right or left. So that is the cranial nerve number 5. So as I have assessed, ma'am, there is some affectation of your cranial nerve number 5. So we will be putting it to test to confirm if it's truly the cranial nerve number 5 that is affected. So we will run through some procedures, some assessments to know if it's really that nerve that is damaged. So I want your cooperation and your honesty as well, whether I am asking you in the procedures that we will do. So ma'am, are there any questions that you want me to clarify?
No.
No? So can we start? Okay, let us start. First, let me get the vital signs of the patient. Assuming that the vital signs of my patient is within normal limits. So, let us begin. For the procedure proper, we will do the cranial nerve 5 assessment. So ma'am, this assessment, we will be doing 3 different assessments and in which we will do some reflex testing, sensation testing, and also the motor testing. So ma'am, are we ready?
Yes.
Okay, let us start. First, we will be testing for your light touch sensation to test for your sensation. Okay, so I want you to sit straight. I want you to relax. Okay, so I will just move this, ma'am. Okay, I want you to close your eyes and I want you to tell me what do you feel. Okay. Okay, so let us start. First, what do you feel?
Soft.
Soft. Okay. Other side. What do you feel?
Soft.
Soft. Okay, how about this one? What do you feel?
Soft.
Okay, soft. This one?
Soft.
Okay. This one?
Soft.
Okay. How about this one?
Soft.
Okay. So, all of it are soft. Okay. Let us proceed to our next procedure. Okay. Still, I want you to close your eyes. We will be testing for the sharp touch sensation. So, I will be using this tip of my pen as a substitute to the tip of the neuro hammer to test for the cranial nerve number 5. Okay. So, I want you to close your eyes once again, and I want you to tell me what do you feel. Okay. Let's start. What do you feel?
Pointy.
Pointy. Okay. How about this?
Pointy.
Pointy. How about this?
Pointy.
Okay. This.
Pointy.
How about this?
Pointy.
Pointy. And this.
Pointy.
Pointy. Okay. So you can open your eyes now. So all of it are pointy. So let us begin. So let me record first for the assessment of the light touch sensation and the sharp touch sensation. Okay. So we will proceed to our next procedure. So this procedure is called the jaw jerk reflex, in which I will test the reflexes in your mouth or on the jaw, particularly the jaw. Okay, let me begin. Okay, so I will use this ball pen as a substitute to the neuro hammer in testing for the cranial nerve number 5. So again, I want you to relax your face, relax your mouth, slightly open. Just close, slightly open, and just relax. Okay, I want you to close your eyes. Okay, I will tap this particular area. Okay, so you can open your eyes now. So we are finished with our jaw jerk reflex. So let me record it now. Jaw jerk reflex. Okay. Okay, and lastly, we will test for the motor function of this assessment. So, again, I want you to sit straight or relax, just relax, okay? Relax, ma'am, relax. So, we're good. Are we good so far, ma'am?
Yes.
You can open your eyes, ma'am, it's okay. So, I will just palpate over here, okay? I want you to open your mouth. Open, close, okay? Open, close. Okay. So, we will be proceeding to our next assessment. So, ma'am, this time, it is still the same. I want you to open and close your mouth, but this time I will give resistance. Okay? Is that okay with you, ma'am?
Yes.
Okay. So, I want you to try opening your mouth in the count of 1, 2, 3, go. Okay. And then, I want you to try to close your mouth while I am giving resistance, putting it down. Okay? 1, 2, 3, go. Okay. So next, for the deviation, I want you to put your jaw to the left side first. Over here. Over here, ma'am. Okay. I want you to resist. In the count of 1, 2, 3, go. Resist. Okay. To the right side. Okay. I want you to resist. Count of 1, 2, 3, go. Okay. So, we are done with our assessments for the motor. So let me record it first. Motor integrity. Okay. Jaw deviation, opening, closing. Okay. So ma'am, so far we are good with our cranial nerve assessment. So I will just contact you further, ma'am, for further testings and also to know what specific diagnosis or what specific intervention I can do to help you alleviate the pain and also the problems that we are experiencing. Thank you very much.
Yes, the affected nerve is the trigeminal nerve, which has 3 different branches. First, we have the ophthalmic, which reaches the scalp and also the forehead. Next, the maxillary, which reaches the nose, the cheeks, and the upper mouth and jaw. And lastly, the mandibular, which reaches the mouth, the lower mouth, and the lower jaw. Since the patient has multiple sclerosis, there is demyelination, which could lead to different affectations. For example, for the motor function, this could lead to weakness of the muscles or there is restriction of motion. And since the affected nerve is the trigeminal nerve, specifically in the case of my patient, the jaw deviates to the right, so the affected side is to the right. If this nerve is affected, specifically the mandibular branch of the trigeminal nerve, this could lead to the paralysis of the masticatory muscles, which deviates to the right or deviates to the weak muscles. The major difference between the Bell's palsy and in my patient's condition is the nerve affected, the movement, and also the pain. In Bell's palsy, there is an affectation of the facial nerve or the CN7, which is the total paralysis of the affected side, which in return the patient cannot feel pain, cannot do any motions like closing or opening the mouth. Meanwhile, in my patient's condition, there is an affectation of the trigeminal nerve or the cranial nerve number 5, in which the patient can still feel the pain and can do motions like opening and closing the mouth, but with deviations.